This is a controversial area, whether we need to know patients' molecular status at the time of surgery for early stage disease, what we do with that information, and what lengths we'll go to get that testing done. I think for patients with stage 1, stage 2 disease who undergo surgery, even stage 3 as well, I think it makes sense to know their EGFR ALK mutation status. And the rationale for that is twofold. One is I think we have to consider the options with regard to adjuvant therapy using EGFR tyrosine kinase inhibitors for patients with EGFR mutations. This isn't evidence-based. There's no evidence that we can improve overall survival with that, but I think it's something we can consider and something I often do. For patients with locally advanced lung cancer, I think it's a bit more challenging. And it's challenging because the mutation testing has to be done on a certain amount of tissue. It has to be done over a few weeks' time, generally. And for those patients with locally advanced disease who we think we're going to be able to cure with concurrent chemoradiation or sequential chemotherapy and radiation, we want to get started quickly with treatment. Moreover, it's a little bit more complicated to incorporate newer tyrosine kinase inhibitors into that curative therapy regimen. So I think that's the more challenging area, a little bit harder to do. For patients with the early stage cancers who've had resection, you already have a big piece of their tissue in the pathology laboratory, and it's relatively easy. Moreover, you have time to do it. So I think everybody should have that done. In addition to the rationale of using adjuvant therapy, we also know that EGFR and KRAS serve as a bit of a prognostic factor for patients with resected disease. This is controversial, particularly with regard to KRAS mutation status. But I think in general, people feel that EGFR mutation status is a good prognostic factor in resected lung adenocarcinoma. And it's helpful to know those good prognostic factors when you're thinking about a patient's future course.